Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. Hello, and welcome back to Season 2 of Health Talk. In today's episode, we're talking about food access in our community and WIC services, benefits, and enrollment. For many of our neighbors, the beginning of November brought uncertainty, leaving many unsure of where their next meal may be coming from. The Central Texas Food Bank has been a leader in helping to support families across our region with distribution sites and events, keeping food pantries stocked. As well, services and benefits provided through WIC, the special supplemental nutrition program for women, infants, and children, are supporting our neighbors with vital resources right now. We look forward to discussing both of these resources today. The Central Texas Food Bank is the leading hunger relief nonprofit in Central Texas. Wow. Thank you. It's terrible to have to talk about this. The Central Texas Food Bank is the leading hunger relief nonprofit in Central Texas, working to provide immediate and equitable access to nutritious food for individuals across its 21-county service area. Through a combination of direct service programs and a network of approximately 250 nonprofit community partners, the Central Texas Food Bank supports over 530,000 food insecure individuals annually. WIC was created over 50 years ago to improve health outcomes for families and individuals seeking support for healthy growth and nutrition. The program provides nutrition support for pregnant, breastfeeding women and families with children younger than 5. Despite the government shutdown and the delay in SNAP benefits, WIC remains funded and can be a critical resource for families right now. Through WIC, eligible participants not only receive access to healthy foods, but it can also receive education, breastfeeding support, nutrition education, and basic health care. Young children can also receive immunizations and screenings. According to Texas Health and Human Services, the program serves 800,000 people monthly in the state of Texas. We will delve further into these important topics with our guest experts today, Jessica Gonzalez and Beth Corbett. Beth is the Vice President of Governmental Affairs and Advocacy at Central Texas Food Bank. Before joining the Central Texas Food Bank, Beth was a managing consultant at Strategic Partnerships, Inc. Beth also served as Chief of Staff at the Railroad Commission of Texas and worked as a public affairs consultant. Beth has held the position of Executive Director at both the Texas Transit Association and Tulane University. She has experience as a public affairs manager at the U.S. Economic Development Administration, a mediation specialist at the National Mediation Board, and a program manager at Navista, Inc. Jessica is the Director of WIC at Austin-Travis County Health and Human Services Department, now known as Austin Public Health. She is the division manager over the WIC program and Mom's Place, which is a lactation support center for Austin Public Health. She's also worked with WIC for the last 22 years. Welcome, Jessica and Beth.
Thank you.
So I'd like to start by asking Beth, how is the Central Texas Food Bank preparing to meet the increased demand caused by the delay in SNAP benefits?
The food bank has really been preparing for this since before the government shut down on October 1st. We knew there would be tens of thousands of federal employees impacted and potentially not receiving a paycheck. And then this shutdown is unique in that it's really the first time SNAP benefits have been threatened to go away, and then have indeed been delayed in terms of their delivery. So our team did a deep dive analysis into the data, looking at zip code level enrollment for SNAP recipients so that we are able to target additional resources above and beyond what we might do in a blue skies period to make sure that those resources are going into the communities with those high SNAP enrollment rates.
So are you having to adjust distribution schedules or locations or partnerships to respond to the bank's?
We are, and we've added additional mobile pantry distributions. You might have seen during the pandemic, as an example, some footage of folks lined up in parking lots. We are conducting over 50 of those distributions for the month of November, so across all 21 counties that we serve, standing up distributions on weekends and in evening hours, so folks who might not be able to attend during the day also will have those access, and again, locating them in areas, in communities with high levels of SNAP enrollment.
So 50 distributions already for the month of November?
That is what is on the schedule, and then looking at standing up more as needed. In addition to support for those SNAP recipients, we've also been doing a weekly distribution at the airport for TSA and CBP and FAA employees who, as we know now, are going on, I believe, their second week without receiving a paycheck. And we're also providing a weekly distribution at Fort Hood, where there are many, many enlisted soldiers, as you all know, who also are struggling right now.
Wow. How are supply chains and volunteer resources holding up as more people turn to food banks for help?
Something that is interesting about the supply chains in this situation is normally when there's a natural disaster, Feeding America food banks, there are about 200 of us across the country, step up to support our fellow food banks. If there's a hurricane in the Carolinas or a fire in California, other food banks will divert and send resources to support them. In this instance, every food bank in the country is facing the same crisis, the same level of increased need, and it's really a unique situation, I would say. We're all ordering additional food. We're, almost in a position to be competing for those resources. And again, it's kind of an unprecedented situation for most food banks.
Kind of like when we couldn't find PPE at the beginning of the pandemic.
Exactly.
What role do your partner agencies play in helping to identify and serve households most affected by the delays?
We have, as you mentioned, an incredible network of over 200 community partners. Those are churches that have a food pantry, there's soup kitchens, other community organizations that provide that boots on the ground, front-facing access for folks. Over 100 of them are right here in Travis County, believe it or not, and they are absolutely instrumental in allowing us to distribute as much food as we possibly can, in addition to the programs that we run directly from our main facility here. They're invaluable because they're in those communities where there is need. Those are their neighbors. They understand. Our main facility is here in Austin, but again, Central Texas is diverse. We have highly urbanized areas, highly rural areas, and those partners really help us understand the unique needs of those unique communities.
What advice would you give to community members right now who are unsure about how to access food while waiting for SNAP benefits or paychecks?
We know that many families are accessing food through our network for the first time in these circumstances. The advice I would give to those families is to not feel shamed or afraid to come visit us, to visit a food pantry. We are here for you. We're here to support you. It is literally our job to feed people when they are in a time of need, and really encourage them to use the resources in their communities.
Yes, we are neighbors.
Absolutely.
How can community members learn more about upcoming distribution events, important resources for their families, their websites or phone numbers?
There are. If you or someone you know, someone in your household has been impacted by the shutdown, is not going to receive SNAP benefits as expected, you can visit centraltexasfoodbank.org. That's our website, and there is a button on the front page you click. It's Find Food Now. It is big, it is bold, and when you go to that site, you can actually enter in your zip code, and it pulls up all of the access points. So again, whether it be one of those partner agencies, one of those partner sites, or one of our direct distributions, you can search for resources that are closest to you.
Great, thank you. We know that our neighbors in rural communities are particularly vulnerable. Can you share more about your services outside of our Austin metro area?
Yes, so among the 21 counties we serve, the majority of them are predominantly rural, actually. And yeah, there are unique challenges in rural communities, limited public transportation options, often very limited community partners, right? We in here in Austin, we have a robust network of nonprofits that steps up and supports the communities. That's not necessarily the case when you get outside of the 5-county MSA.
Yeah.
So what the food bank does is really try, again, to tailor direct programming. So we are staging those mobile distributions across every single one of our 21 counties every single month.
Okay. And how is the food bank preparing to sustain this increased demand?
Well, the increase in demand is huge. To put it in perspective, for every meal that the food bank network across the country provides, SNAP provides 9. That is a gigantic delta, certainly not long-term sustainable for the charitable network, for the food bank and our partners to make up that gap. What we are doing, we have purchased additional food. Prior to the shutdown, we were spending about $1.3 million a month purchasing food. Now, in addition to that, we're spending an extra $1 million per week, just to illustrate what that huge increase has looked like.
Wow. What lessons from past crises like the pandemic are helping you to respond more effectively now, would you say?
So many lessons.
Yeah, right.
I think, since the pandemic, we learned, and this isn't necessarily exciting, but we really learned that using data to drive where our resources go is critical. Making sure that we're having the biggest impact we can, locating people where they are, so we're bringing the services to people where they are. We know that a lot of folks aren't able to access their local food pantry for a variety of reasons, so we really are trying to tailor programming. We've started to locate pantries in elementary schools, as an example, schools with a high level of kids on free and reduced lunch. So making sure, again, we know parents will be there to pick up the kid. We know that might be the only time they have access to a car, so we make sure that the groceries are available in those locations. We deploy what we call our mobile pharmacy. It's FARM. ACY to health clinics around the region. Again, wanting to make sure when people are out getting health care, they can also get healthy food.
That's great. You're co-locating the non-medical determinant of health.
Absolutely.
Nice. So what can Central Texans do right now to support their neighbors and friends and support the food bank's mission during this period of instability?
What you can do right now to help your neighbors, many of whom may be and probably have been impacted by this shutdown, is to donate. It might be donating dollars, it might be donating your time. Another resource we offer at the food bank is a full team of staff who helps enroll folks in benefits like SNAP and WIC. They can also, when they're for an appointment, visit our on-site food pantry. It's a beautiful, very dignified shopping experience. So I'd encourage folks to call the food bank to make an appointment with that team. That number is 512-282-2111. That number is 512-282-2111. And it might be lending your voice to advocate for those who are facing really tough choices right now between food and bills and rent and all the things. So again, you can go to centraltexasfoodbank.org. Right next to the Find Food Now button, there is a Donate Now button. There are also opportunities to volunteer either at our main facility. We have a commercial kitchen, a garden, a warehouse, something to suit anyone's preference. And you can also donate at our mobile distributions for those who really want to participate in that community-facing support.
Thank you.
Thank you.
Jessica, I learned about WIC, something new about WIC today. Tell me about WIC. Who qualifies for it?
Okay, so WIC is a supplemental nutrition program, as you stated earlier. We do target the population of pregnant, breastfeeding, postpartum, and then kiddos up to age 5. There is an income qualification that is 185% of the federal poverty level. So as long as they meet the categorical as well as that income level, they can qualify for WIC. We do also use adjunctive eligibility, which means if you are on Medicaid, SNAP, or TANF already on those programs, then you automatically qualify for WIC based on the income.
Wait a minute. So you're saying 200% of the federal?
185%.
100, okay. And then also, if you're already getting something like Medicaid or SNAP, you qualify for WIC?
Yep, because you already met those qualifications for those programs. So, and those program qualifications are lower than WIC's.
Okay.
So you would automatically qualify for WIC.
Great.
Based on that income.
So what's the purpose of WIC? Tell me about that.
So WIC is, like I keep saying, we are a supplemental nutrition food program. So we're here to provide that food and the education for our families. So we want to give them a successful start to life and help impact health outcomes in the long run.
And one of our guests earlier said that 1 in 4 children are food insecure. So WIC is really an essential piece of helping kids be successful.
Absolutely.
Why is WIC such a critical resource, would you say, in our community?
So WIC is the nation's most successful and cost-effective nutrition program. And so, as I stated, it helps with health outcomes. So it's been linked to better birth outcomes, longer, safer pregnancies, just healthier starts for infants and children in general, and it, of course, reduces food insecurity.
So we increase birth outcomes. That means we have healthier babies.
Healthier babies.
We have better pregnancies.
Better pregnancies.
And we have better health outcomes in general.
Yes.
So we really need food. Food is one of the most basic
That's the
things,
basic,
right?
yes.
Yeah. who or what funds the WIC program, and how is this program administered and overseen?
Right, so WIC is federally funded through the USDA. Money is appropriated through Congress every year, and then that filters down to the state level and then down into the local agency levels. Every local agency has a parent agency, so for us it's in Austin Public Health. And for other agencies it might be a county agency or a hospital, but every local agency has a parent agency that oversees the operations.
So what's the difference between WIC and SNAP?
I'm glad you asked. That's an important question. So WIC targets a specific population. We provide nutritious food to that specific population. We provide nutrition education, that breastfeeding support. We have one-on-one counseling with nutritionists, registered dietitians, lactation consultants, breastfeeding peer counselors. So that's a one-on-one resource that these clients have access to. And then we also provide in-person classes, we do virtual classes. So there's a lot of education component to that food benefit. SNAP does not have a specific target population, so it's not based on category or age, and they give a dollar amount for basically any, well, I don't say basically, they give a dollar amount for almost any food.
Okay. Is WIC still an available resource for Central Texas families who need food during the government shutdown?
Yes, absolutely. We are here to help your family.
Great. And can WIC serve as a supplemental resource while SNAP funds are stalled? How many families have historically received SNAP benefits that can benefit from WIC? Do we know?
So I do have a general statistic. Varies from year to year, but in general, about 20% of kiddos who are on SNAP currently receive WIC benefits. So there's a gap there that for sure more could benefit from the program. If you look at SNAP in general, about 50% categorically would qualify for WIC. So it is really an underutilized program by SNAP recipients.
Okay.
But yes, we have the capacity to help.
Thank you. And what's the biggest misconception about WIC and how the benefits are used?
Right. So a couple of things, I think even just per conversation earlier, one misconception is that SNAP and WIC are the same thing. They are not the same thing. As I described, we are two different type of supplemental programs that are here to help families. We help in our own different ways. Another misconception is that WIC is a formula program. We do offer formula, but we offer so many other things as I've described, right? Including all those education components and the breastfeeding support. And then I think another thing I want to mention here is there's a buzzword of abuse of programs. And I want to say in my time with WIC, I've been with WIC in Texas for 22 years. And I would say in general, what I have heard a lot from families is, I can get by with just my SNAP or just my WIC. I want to save money. I want to leave money on the table for other people to utilize these programs. So I think what I hear from that is that these are hardworking families that are just trying to make ends meet with just a little bit of support, and that abuse is by far comparatively very low.
Yeah. What can WIC provide for families? What services are available to those who are enrolled? And who's not enrolling that needs to be thinking about WIC right now?
Who's not enrolling are probably those early in their pregnancy. A lot of moms don't think about WIC until, I'm about to have my baby. I want to make sure I'm on it to receive those benefits post-baby. We want to get you as early as possible. We want to make sure that you have that healthy pregnancy. We want to get you your education and your nutritious foods. So that I would say is probably the population that is not enrolling that should enroll earlier on. As far as what can WIC provide, I've already talked about food. I've already talked about breastfeeding, all of that. In addition to all those things, we have specific foods that we do provide, and that's milk, cheese, eggs, beans, whole wheat. We provide, as part of our breastfeeding support, we can provide breast pumps. Here in Austin and Travis County and Bastrop County are the service areas that we provide services to, we have a mobile unit that goes out to areas like People's Community Clinic, Travis County Community Center at Oak Hill, Carver Public Library, those kind of areas to help meet our clients where they're at and to provide those convenient services. On top of that, I think another important thing that we offer is just a sense of community in general. Under the Austin Public Health Facebook page, we have a group called ATX Family Cares, and we're 11,000 strong in that community, and that is families helping families, asking questions, answering questions, and just supporting each other in general.
Yeah, and that's so
Absolutely.
Where is WIC accepted and how does it work?
So WIC is accepted at most markets like H-E-B, Walmart, Target, but also at places like JD's, locally, Los Vaqueros. WIC is accepted at our Sustainable Food Center farmers markets. So they can take their WIC dollars and actually triple their money there at the farmers market. So say for instance, we have a kiddo that gets $26 of fruit and veggie money on their WIC benefits. They can go to a Sustainable Food Center farmers market and get an additional $52 to utilize there at the markets. So that's one way they can stretch their dollar. As far as how they use it, they go shopping just like normal. They can use their MyWIC app, which helps them shop. It'll show them what is approved and what's not approved for their specific food package. And then they just check out with their WIC card at the cashier.
And it's for pregnant women and their children up to age 5.
Up to age 5, yes.
How does someone enroll to receive WIC benefits?
So you can enroll a couple of ways. You can start with texaswic.org. That's Texas spelled out, TEXASWIC.org. You can learn about the program there, and then you can actually start an application on that website. Locally, you can call us at 512-972-4942. You can ask questions to a live agent, and they can schedule you an appointment to get on the program.
Okay. And what other agencies are supporting WIC?
So WIC is actually receives bipartisan support. So we are supported by a multitude of federal and local community organizations, including American Academy of Pediatrics.
How can people support the WIC program?
So you can support first off by enrolling. If you qualify for the program, Enrollment shows a need for the program, and that tells our policymakers that there is a need for the program. If you do not qualify for the program, you can contact your local elected officials to voice your support for the program. And if you're a community partner, we can partner and we can promote each other. And what else should our listeners know about this program? What else should our listeners know about this program? You can visit austintexas.gov, so that's all spelled out, AUSTINTEXAS.gov, and you can search WIC, and that'll take you to a landing page that'll give you a lot of resources. It'll tell you, it'll show you a list of our clinics, give you some breastfeeding resources, and also show you the mobile unit schedule that I was mentioning earlier, and how to start an application. Thank you, Jessica. And that number for WIC was 512-972-4942. And to donate to Central Texas Food Bank, you can go to centraltexasfoodbank.org and look on their landing page for the donate button. You can donate your time, you can donate your money, and you can also donate food. And I want to thank you both for joining me today. That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.